Chemotherapy, as the name suggests, we use chemicals for treatment of cancer. Now, when we use these chemicals for treatment of cancer, when they go inside our body, they interact with the body system in a certain manner, and they are supposed to kill those cancer cells inside our body. When they kill those cancer cells, since they are part of our system now, the drug is moving in our blood, they also harm our body in certain way. Most important part here is they cause nausea, vomiting, loose motions, blood counts can get reduced, because cancer chemotherapy drugs have certain properties to identify and kill all the cells which are rapidly dividing. So the cells which are rapidly dividing in our body are the cells that are lining our intestines, the cells in our hair follicles, the blood forming cells. These are very rapidly dividing cells because they have to produce new cells on a regular basis. Cancer chemotherapy drugs act on all these cells. That is why we see hair fall. That is why we see patients developing vomiting, diarrhea, and other symptoms. That is why we see patients losing blood cells. Cell counts go down. So how do we make it sure that there are minimum side effects of chemotherapy drugs? Now it's important to understand the same concept on which the cancer chemotherapy works. Like for hair loss prevention, we have scalp hypothermia machines that help us prevent hair fall due to cancer chemotherapy. Similarly, the blood counts are falling. That is why many times doctors would prescribe you growth multipliers or the blood cells that are to be promoted. They inject certain drugs for that.